I think the first thing we need to understand is that with this crisis, this is unprecedented. It's nothing like we've ever experienced before. So we are all at heightened levels of stress. So I think we need to recognize how we're experiencing stress and then what we need to do to help cope with it. So one of the acronyms I like to use is HALT. Recognize when you are hungry, angry, lonely, or tired, when you feel yourself being on the edge. When you can pick up those signs in yourself, then that's a cue that you need to do something about it. Another thing I recommend is good self-care, and here's an acronym to help with that. So I've come up with something called NEST. So for the N, it's to nourish and hydrate. So we, especially in times like this, we need to fuel our bodies, we need to fuel our brains, we need to stay hydrated so that we stay healthy and have a nice, healthy immune system to help us fight off this disease as well. For the E is exercise. And exercise is critical, not just for physical health, but for mental health as well. There's so many benefits for exercise. So even though we're restricted and you can't go to the gym or to public spaces or go for a hike, figure out how you can use the space that's available to you to get some exercise daily. So the recommendations are at least 30 minutes, 5 days a week, at least. And if you have children in your household, they're going to need more than that. So children need at least an hour a day. For the S, that S stands for social connectedness, social support. So although we have to socially distance and physical distance, it is social connectedness that's going to get us through this crisis together. So maintain those social ties, use technology as much as you can to keep in connection with people, to check in on others, and also allow them to check in on you. And the T stands for tweak the plan. So the uncertainty of this pandemic means that it's a rapidly changing landscape. Every day we're not quite sure what new measures might need to be implemented. So you may put some plans in place and they're working for you, and then guess what? It may not work as effectively the next day, or we're required to do something differently. So be flexible enough to tweak your plan and make the adjustments to what best suits you.